Hi guys, good morning and welcome to my channels. My name is Violet Okolocha. In my videos I actually talk about everything about OSCE exam and sometimes about nursing here in the UK. So how are we all doing? I know we are all fine. I just want to say a very big thank you to everyone that has been supporting me as well as this channels. Guys, I truly appreciate it. And if this is your first time of watching my videos, please subscribe and hit on the notification bell, and I would love to read your comment. So guys, thank you so much. Happy family. I really appreciate, and God bless us all. Now today I'll be doing a video about GCS monitoring. Now before I do this video, I'm going to ask every one of us a question. Before now, how often do you feel we should monitor and record GCS? Give me your options. A lot of people have come to my timeline. How often should we monitor and record a GCS observation? So guys, I leave that to you now. I would love to read your comments. Tell me how frequently or how often you feel we should monitor and record a GCS observation. Now, before I go ahead to say that to you, I just want to quickly plead with every one of us preparing for OSCE exam. Now, once you are in a planning station, planning is actually 15 minutes. Before you start your planning, can I beg every one of you to do me a favor? Endeavor to write your name, endeavor to sign, and endeavor to date it. The reason why I'm saying this is best known to me and those who are close to me, but I plead this to everybody. Endeavor to write your signature first, write your name and your date before you start your planning. I don't want to feel bad about it when I keep getting it on my DM. I wouldn't say much about this, but just do that for me in your planning. Okay, guys? So now let's get started. Now, GCS monitoring is strictly according to NICE policy. NICE policy is NICE. You know, I keep saying nurses are intelligent people and nurses are brilliant people. So we're all going to put our heads together and talk about it today. So GCS monitoring is strictly according to NICE policy. And what is NICE policy? NICE policy, or NICE guidelines rather, is the way they monitor patients who have head injuries, like a guide on monitoring patients with head injury. So now, for the purpose of GCS monitoring, the minimum number of frequency, or rather the minimum frequency to monitor a GCS patient according to NICE policy is 15 minutes. That is the minimum. But the standard is a GCS patient should be monitored every 30 minutes for the first 2 hours. Hourly for the next 4 hours, and thereafter 2 hourly. I'll come again because I really want us to catch it. 30 minutes, which is half hourly, for 2 hours. That is the gold standard. After which, 1 hourly for 4 hours, and thereafter 2 hourly. Now people keep saying, so what should I write in my OSCE exam? If you write 15 minutes, it's fine because that is the minimum frequency according to NICE policy. Now, to buttress my point further, I will be giving you a care plan for GCS. Now, for a GCS patient, there are 1,001 care plan. You know, for a GCS patient, a lot of time they always present with headache, high temperature. So headache is, your care plan could be patient is having headache, or with a pain score of blah blah blah. Your second care plan could be risk for fall, because there are risk for fall, risk for deterioration, confusion is part of it. So there are a lot of care plans for GCS. So I will just give 2 care plans for GCS just to buttress my point for that. Now let's assume we have in my OSCE exam now, I have a GCS patient, and I interact with the patient, and from my interaction and from the chat given to me, I know the patient has headache, and the patient is having a GCS of 14 out of 15. So now look at my number 1 care plan. I will assume the patient is Mr. A. Mr. A is having, I don't like too much English, but I know you nurses, you are so brilliant and intelligent. So some people will not say Mr. A is having. Some others will rather say Mr. A is experiencing headache with a pain score of 7/10. Because from your interaction, you already know the pain score the patient is having. But some people who are very bright, nurses are professors now, overknow, they know they are intelligent, they will always want to use Mr. A is experiencing headache due to head injury with a pain score of 7/10. Now, what will be my aim of care? My aim of care is Mr. A will verbalize a relief of pain with a pain score of less than 3/10. I'll come again. Mr. A is experiencing headache due to head injury with a pain score of 7/10. And my aim of care will be Mr. A will verbalize a relief of pain with a pain score of less than 3/10. Now, what should be my reevaluation date? To be reevaluated today, you write that date, every 30 minutes, and as the clinical condition changes. So now, we all know about the care provided by nurses is strictly according to Untitled. The care provided by nurses strictly according to Untitled. If you have not watched my video about the use of Untitled in Careplan and Husky, just go back and watch that video to help you understand it more. So if we are going by Untitled, E is what? Explain and discuss all aspects of care to patients and gain consent for all intervention. And we know him. Monitor and record GCS and observation every 30 minutes. Someone is looking at me. What will she say? Every 30 minutes for 2 hours, hourly for 4 hours, and thereafter 2 hourly. If you are not okay with this, you can write monitor and record GCS according to NICE policy. If you are not okay with this, like I said earlier, the minimum frequency is 15 minutes according to NICE policy. You can write monitor and record GCS observation according to NICE policy, or monitor and record GCS observation every 15 minutes. Whichever of the three I have said is all right, and it will definitely give you that. Okay, guys, so the next is A. You assess Mr. A for pain using the pain assessment tool. Then the next is T. You teach Mr. A deep breathing exercise, you teach diversional therapy, you teach repositioning. And the next is A. You administer all prescribed medication and monitor each frequency after 30 minutes. And the next is R. Who are you referring Mr. A to? You are referring Mr. A to the what? To the pain management team. And the next is I. Inform Mr. A to use the Careplan, and the next is D. Document all care plan. Now, we all know patient self-care activity. Now, patient verbalizing understanding of the plan of care. Patient participates in a plan of care. Patient is able to use the Careplan. Patient understand diversional therapy. We all know that. So I'm sorry I'm being fast about that. Okay, guys. Now, the second one is Mr. A is at risk for neurological deterioration. And make sure to put the GCS score there. If your patient is having a GCS of 14/15, put it there. Mr. A is having or is at risk. I'll rather use risk. Mr. A is at risk of neurological deterioration with a GCS score of 14 or 13, depending on the score you have. And what will be my aim of care? Mr. A will have no sign of neurological deterioration. No sign of neurological deterioration with a GCS score of 15/15. And like I said earlier about the reevaluation date, is to be reevaluated today every 30 minutes. And as the clinical condition changes. Now, what do you do here? Remember Untitled. Explain and discuss all aspects of care to patients and gain consent. Monitor and record GCS observation according to NICE policy. Or monitor and record GCS observation every 30 minutes for 2 hours, hourly for 4 hours, then thereafter 2 hourly. Or monitor and record GCS observation every 15 minutes until you get a GCS score of 15/15. So whichever you choose out of those three is what is all right. Then the next one is A. Assess Mr. A for signs of deterioration such as nausea, such as vomiting, such as lethargy, and such as restlessness, So the next one is T. Teach and orient Mr. A to time, place, and person. The next one is A. Administer or prescribe medication and monitor its effectiveness after 30 minutes. The next one is R. Refer patient to neurological team. Yes, guys, we have a neurological team. So refer Mr. A to neurological team. And the next one is I. Inform patient to use call bell and place patients close to the nursing station. When you place them close to the nursing station, you are always, you're always looking after them. They are closer to you. And document all care as what? All care done, or document all care as what? As planned. And we all know the self-care activities already, guys. So guys, having said that, I want to plead with us before we start our OSCE exam, or rather, should I say, before we start our planning, please endeavor to sign first, endeavor to write your name, and endeavor to write dates. Please, guys, don't forget to sign. And that is why I'm begging you, sign first before you start writing your planning, just so you don't forget. Please, the reason I'm saying this is best known to me and those close to me, but please, before you start your planning, make sure to sign. Okay, guys? Now, having said that, I'll be having a Zoom class, another Zoom class, and strictly about assessments, which is news, must, PHQ9, and GCS. We'll be talking about everything about assessment, and we're not usually much. We always share ourselves into groups just so that we have easier assimilation and so that everybody can have a goal, So if you are interested, just keep a comment saying you are interested in joining the Zoom class, or rather the WhatsApp class. We do it while not plenty. We usually do it in group. When we're too plenty, we share it into another division, maybe A class, B class, C class, blah blah blah, stuff like that. And all we do is about assessment for now, which is news, must, GCS, and PHQ. Like I said, we are usually very few and share it into different divisions so that everybody can have a goal. If you are interested, drop a message saying you're interested. I will send you my email, then we could talk about the class. And the next class is supposed to be on the 6th of March, 9 p.m. UK time. On 6th of March, 9 p.m. UK time. And I'm guessing 6th of March is on Saturday, 9 p.m. UK time. Like I said, if you're interested, drop a message saying you're interested, and I'll send you my email address. Then we can talk about it more. Now, thank you so much, guys, for watching. If you have any comments, you have any questions, you have any concern, don't forget to comment it, and we'll talk about it more, okay? And I just want to end by saying a big congratulations to all those who have passed their OSCE exam. I'm super proud of you. And for those who had 1 or 2 receipts, oh my God, bless you. Just understand the reason for that receipt, and go and smash it. I can't wait. I mean it. I can't wait to congratulate you. Okay, guys. So thank you so much for watching. For all those who have been supporting me, I say a big thank you. And please, if you have not subscribed to this channel, please subscribe and hit on the notification bell. And I would love to hear your comments. And very soon, I'll be doing skills, because a lot of people have asked me to do skills. So I'll be doing back-to-back skills. So stay tuned, guys. Thanks for watching. Have a pass in your OSCE exam, and I can't wait to congratulate you. Bye, guys.